And we are live. A very good afternoon, everyone. This is Batul, the moderator for today's session from IJCP, and I would like to welcome everyone wholeheartedly at our platform for the better exchange of knowledge that is going to be shared by our renowned stalwart who is present here with us today. Well, Sir needs no introduction, but yet it's our great pleasure and honor to introduce him. He's none other than the very renowned radiation oncologist Dr. Somrat Bhattacharjee, Sir. Sir is MBBS, MD in MD, and medical director and senior radiation oncologist at HCG Cancer Center, Bangalore. With Sir's wonderful insights, we are going to talk about the topic for today, which is a paradigm shift of cancer diagnosis and management. Before moving on to today's discussion, let us have a brief look on what we are going to talk about. So, in this insightful webinar, we'll be talking about on the latest advancements and evolving landscapes in cancer diagnosis and management. We will also discover how innovative technologies and research breakthroughs are transforming the way we understand, detect, and treat cancer. So, now without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him for his precious talk to begin. Sir, over to you. Please proceed.
Yeah. So, good afternoon, everyone. I am just describing from the very beginning what is cancer and what are the different symptoms and how the process starts, how we diagnose cancer, and how we treat cancer in today's world. So, my first slide is about HCG, our Healthcare Global Hospital. So, Healthcare Global is South Asia's largest cancer hospital chain. It has around 24 state of art cancer hospitals in the country and abroad. Around 140,000 new cancer patients are coming every year from all over the world for treatment. Around 400 plus cancer specialists are working here in all our centers, and it works on spoke and half technology. It is a very interesting technology, just like the wheel. So center is the hub and all are the spokes. So hub is our hospital and spoke is all other centers which are connected with our hub. Now, statistics, just imagine how serious this cancer is. As per the ICMR report of 2021, one woman dies of cervical cancer every 8 minutes in India. For every two women newly diagnosed with breast cancer, one woman dies of it in India. As many as 2,500 persons die every day due to tobacco related diseases in India, and smoking accounts for 1 in 5 deaths among men and 1 in 20 deaths among women, accounting for an estimated 930,000 deaths in 2010. Now, a very big basketball player, Jim Valvano in US, he got cancer in the prime of his life. But then he told, cancer can take away all of my physical abilities. It cannot touch my mind, it cannot touch my heart, and it cannot touch my soul. Now, genes, because our entire treatment and discussions today are revolving around gene. So, what are genes? So, genes, the basic biological unit of heredity passed from parents to a child. Genes are pieces of DNA and are located on chromosomes. Okay, now facts about chromosome or gene in human cell. In a human, there are 30 trillion cells. The length of chromosome, that is DNA, equal to 2 meters. And if we combine the length of all the genes in a human body, it is equivalent to 100 astronomical units. And just imagine the distance between the sun and the earth is 1 astronomical unit. So that way, 100 astronomical unit is the length of all the genes. And if you see the length of our DNA, it is equal to twice the diameter of the solar system. So many genes are there in the body. Now, history of cancer. 300 million years ago, dinosaurs had carboniferous cancer. Carboniferous is a type of fish available 300 million years ago who had cancer. First cancer recorded in human was in ancient Egypt 3,800 years ago in Khartoum, and it was in the scapula. The word cancer has come from the word crab because it moves like tentacles of crab. Now, why this disease is so dangerous till today? Because this is the only disease where the in between junction of the cells, which is known as desmosome, get loosened, and so the affected cancer cell can move in the body and go to any area. Further, it is genetic in nature, and in cancer, the cancer cells ultimately become immortal. Now, difference between benign and malignant. So, benign tumors, you all know, grow very slowly. Malignants are very fast growing. Benign tumor is a well capsule, but malignant tumor does not have a proper capsule. Benign remain in the same area. Malignant cells can move anywhere in the body. And in histopathology, the benign cells are uniform in uniform nucleus and they take moderate stain, whereas cancer cells are not uniform, nuclei are bigger and they take deep stain. And benign, they can be removed completely surgically, whereas cancers cannot be removed completely. So benign cannot kill patient, but cancer can kill patient. Now, common causes for cancer. Though the exact cause of cancer is not known, but the probable causes are one is cigarette smoking. Now, see the data. Cigarette causes about 1.5 million deaths from lung cancer per year. This will be 2 million per year in 2030 as per British Medical Journal. A study of Morris et al. Shows 25 cigarettes smoking per day for 10 years increased risk of malignancy 18 times in lung and increases risk of breast cancer. Alcohol, along with smoking, is more dangerous because some of the carcinogens which are available in the smoking are soluble in alcohol, so it causes more dangerous effect. Viruses like human papillomavirus, herpes virus, Epstein-Barr virus, etc., they are responsible for cancer. Radiation is a cause of cancer, and congenital genetic disorders like familial polyposis coli, they also causes cancer. Now, how cancer cell grows? So you can see here when a single mutated cell grows in our normal cells, then this mutation continues and ultimately it turns into a malignant cell, and then it grows very fast. The population of the malignant cell increases it very fast, and then they start the metastatic. So ultimately this pink area will go into the metastasis of the cancer. How this spread? So here also we are seeing, say, in a colon cancer, a single initially adherent cell, this is the cell, gives rise to some proliferative cells, which again increases the proliferation, and now it is forming a tumor or an adenoma. And as the growth continues, this adenoma will turn into malignant adenoma, which is known as adenocarcinoma. And then from there, these are the blood vessels. So the cancer cells will come out and enter into the blood vessels. So these are the blood vessels in which cancer cells have entered. And then through bloodstream, it will go to any level, any direction, and any place. Now, what are the diagnostic facilities and treatment of ACG? So first one is, I just want to tell something on breast. Now this is the breast cancer. See, these are the milk glands, and this is the cancer. And the skin over the breast is having a dimple here. So this is a warning sign. If on the smooth skin of the breast you get a dimple or depression, then inside there may be cancer in very advanced stage. So this is very, very important diagnostic point. Then this is a very interesting story. This girl, Elisa Hunter, who developed cancer when she was at the age of 2 years. So when she was 2 years old, she developed juvenile secretory breast carcinoma, and for that reason, Her both the breasts were removed by surgery because this is a very dangerous cancer. So just imagine at the age of 2 years, she was diagnosed with cancer. Now, there are some facts about breast cancer. This is the second leading cause of death in women, second most common cancer. Incidence increases with age, and all women are at equal risk. This is from American Cancer Society 2024 report. Now, genes, I told you, gene is the ultimate today for the cancer treatment. So, gene comes basically, it is the nucleus, from inside the nucleus, the chromosome, and each chromosome is nothing but coiled up by gene, DNA. And part of the DNA or segment of the DNA are known as the gene. So, they are very important for diagnosis and treatment. Now, some genes like BRCA1 and BRCA2, they are very important to know who are more susceptible for cancer. Like say father is having affected gene, mother is having non-affected gene. So suppose there are four children, so out of four, one boy will have affected gene, one girl will have affected gene, but other one boy and another girl will have normal. So this happens. This is known as inheritance with high penetrance. So there is a 50% chance of inheritance, and lifetime risk of cancer is 30 to 70%. Actually, BRCA1 is in chromosome 17, and BRCA2 is in chromosome 13. Now, risk factors for breast cancer, gender, females are the most common targets or they suffer mostly. But even 1% male also suffers. Race, more common in whites, age increases as a woman gets older. Relative, if mother is having breast cancer, the risk for the daughter is high. If mother and first daughter both have breast cancer, for the second daughter, risk is very high, almost 70%. Menstrual history, early on onset, late menopause, these are all very risk factor for breast cancer. Childbirth, first child after the age of 30 years, or having no children is of high risk for breast cancer. Then obesity, diet, fat and alcohol increases risk of breast cancer. Lack of physical activity, stress, radiation exposure, history of cancer like breast, uterus, cervix, ovary in the family increases the risk of breast cancer. Hormones, estrogen in hormone replacement therapy and birth control pills. Genetics, certain conditions are inherited. Symptoms. So today WHO has suggested for all girls from the age of menarche till death, they must examine their own breast, and there are 10 points on the basis of which they can detect whether there is a cancer or not, and they can immediately come to a doctor and get the proper treatment. Now, a very common question, a girl says, do I have cancer, breast cancer? Now, today we have a very good answer. Yes, by PET scan we can find it out. I'll show you. So, how we diagnose a breast cancer? So, a lady comes with a lump in the breast. We do mammography. So, mammography is nothing but X-ray. Here, X-ray beam is coming and breast X-ray is taken, and that picture comes. So, these are the pictures. Now, there are different levels which are known as BIRAR score, Breast Imaging Reporting and Data System of US. So, this is very important. If it is BIRARS 1, there is no cancer. BIRARS 2, again, there is no cancer. BIRARS 3, there is some heterogeneity, matlab it is not very clear, but still there is chance of cancer is very low. Not 4, the cancer chance is becoming gradually high. Now BIRAT 5 means almost 90% chance cancer is there. And BIRAT 6 means already cancer is detected in one breast. Now we are seeing other breast. So these BIRATs are very, very important when we do the mammography or sonomammography. So this is sonomammography. They did the ultrasound. Usually it is done before the age of 40 years. They do the ultrasound, and in ultrasound they see the breast, and even they can do the FNSC. So see, this is the breast mass. They are seeing in the ultrasound. They are putting a needle, and they are seeing the needle is coming up to the breast mass, and they will take a piece, and that will be the biopsy of the breast mass. Now, MRI. Sometimes we do MRI of the breast, which is very important. It shows very clearly. See, MRI is showing this mass in the this breast, whereas other breast is normal. So this mass is mostly cancerous. You can see in this MRI, this part of the breast is very dangerous. It can be cancerous. Now the PET scan. See, this is the PET scan. So I have done a PET scan. See, the light is coming from this breast. So this looks most probably it is cancer. You can see here, breast light is coming, and from the liver, almost from entire liver, light is coming. So this is a very advanced cancer. So breast self-examination today is very important for a woman from the age of menarche till her death, because even in very early stage, she can feel something, she can come to the doctor can diagnose and treat, and maybe completely cured sometimes. This is medical cyclotron we have in our hospital, by which we are making all the radioisotopes. Now we have several different types of nuclear medicine scans. One is OncoView scan. Today we are doing almost in all cases OncoView scan. It is very accurate for breast, for any cancer. Choline PET scan, it is done for parathyroid hyperfunction. Ammonia scan to see cardiac function and coronary flow. Methonic scan for brain tumor. Then FDOPA also for brain tumor. They are very specific for brain. Then PSMA, prostate specific membrane antigen PET scan for prostate cancer, and even for brain tumor like glioma or glioblastoma. Dotanuc scan for neuroendocrine tumor. Dotatate, the treatment for neuroendocrine tumor by an isotope. FDG PET CT, it is a very broad spectrum. It is 18 fluorodeoxyglucose. Now we don't do much because it sometimes causes some confusion, because it may be TB, it may be some other infection. That also shows like cancer. So we mostly do OncoView. F18 is to see any metastasis in the bone. Gallium 68 is diagnostic for prostate cancer. And FAPI is used for OncoView, FAPI 4, and FAPI 9 is used for treatment. So today we are treating advanced cancers with FAPI therapy with extremely good result. See, this scan is showing why PET scan is so important. See, this is the CT scan, and see there is a cancerous growth here in the internal mammary gland, but in the CT scan you cannot see clearly. Now we did the PET. So PET is showing that gland only. Then we combine CT with PET. See, we are seeing here the light has come, and it is showing you exactly where is the problem. So PET CT is a very important mechanism today to show growth in the whole body, cancer in the whole body. This is meningioma. So meningioma sometimes can be detected by DOTA scan. You can see the light. It's very specific for meningioma. Then for prostate, prostate is the organ which is very important through which the urethra is going. So prostate cancer is common today, and we are detecting by a special scan which is known as PSMA PET scan. So PSMA will show, see, these yellow things are all cancerous. This is cancer in the prostate. It is very accurate for prostate cancer. Same, prostate cancer. Then in the liver, this is a normal liver. Now in the liver, we get several cancers. So this is again PET choline, by which we can see the cancer like this. Or OncoView, we can see the light from the cancer area. from the liver. So they are very accurate scans. Then for the brain, we have DOPA. DOPA is a very important PET scan. See, in the MRI, it is showing like a shadow, but we are not sure where is the actual cancer. So we did the DOPA, and DOPA is showing the cancer is there. This is the actual cancer site. Same thing in this MRI of the brain, you are seeing a diffuse picture. You are not very sure where is the exact cancer. Do the DOPA, see, exact cancer is here only. Here only. Otherwise, all other areas are like non-cancerous. That there may be edema or something, but they are not cancerous. Cancer is only here. So this is showing for any cancers how this PET scan helps. See, this is PET scan, this is MRI, and this is CT scan. So this PET scan is 1,000 times sophisticated than MRI or CT scan for diagnosis of cancer. Now, this is the heart. So heart, has many stories, many adventures. Stars from 23 day of life pumping. So how to see this heart in a more thorough way? So we have a very special scan which is known as MUGA. So we inject the isotope and we see the condition of the heart every second, and we know which area of the heart is active, which area is inactive. Even you can see which area is getting infarct, which area has low blood supply. Everything you can see. It is a real time. So exactly time wise you can tell which part of the heart is having problem. And this is very effective for our chemotherapy also. Now we have one of the latest MRI. This is 3 Tesla MRI. And by this MRI, we can do 9 different types of scans, which are very, very helpful for our diagnosis. We have PET MRI when we do together MRI and PET to show the best result. See, in MRI, this is a normal MRI. Now, this is known as MR spectrography. We are seeing all the tracts in the brain. So cancer area is this much. Same MRI. Actually, cancer is here, but you cannot see properly. So here by spectrography, I can see. Then MR diffusion. By blood flow also we can find out where is cancer. And this is DOPA. See, this is the exact cancer area. Same picture, it is here. And it is DOPA here. So this white one is the exact cancer area. So this accuracy is very, very important for our treatment today. Same thing. Here I've done an MRI of the brain. I'm not sure where is the active tumor. So active tumor is here by DOPA. So by DOPA you can see very clearly where is the cancer. These are all pictures. Normal, MRI, DOPA. MRI, see, this is the MRI picture. See the actual DOPA picture. DOPA, cancer is here. Now, this is very interesting slide. See, I did an MRI of the brain. An MRI is showing like this, as if the tumor is here. But when I did the DOPA scan, it is showing no, tumor is here. It is here. This area, not in this area. So this is a geographical miss. That's why DOPA scan is so important for the cancer detection in the brain. It is one of the most accurate diagnostic tool for brain cancer. Now these are the different isotopes we have for brain mapping, for brain tumor diagnosis. Even we diagnose Parkinsonism. So many other disease can be detected today by PET scan. Now, this is a very important part, the genome. Today, I told you entire cancer is revolving around genomic. So, if you know the genomic, you know everything, and you can give the exact treatment today. So, in HCG, we give tremendous importance on genomic and gene, the gene structure of the person and the tumor. So, it is nothing but study of the complete set of genes or gene material in the body, that is the genomic. And genetics is the part of the DNA which we see individually. Same thing from the this thing nucleus. I have taken one chromosome and it is, I am just taking out the DNA. This is gene. Gene means one portion of the DNA which produces one type of protein. So see, all carcinogen, radiation, everything is working on this DNA. Sometimes there is a single strand break, sometimes double strand break, and accordingly the cancer advances. These are hereditary cancers, different breast cancer, ovarian cancer, see, breast cancer, ovarian cancer, they're all involved in hereditary. They're all hereditary. Now, so genetic counseling today is very, very important for the diagnosis, whether the disease is hereditary or not, type of inheritance, genetic risk for other family members, like familial polyposis coli. In a family, there are many members will have lot of polyposis in the colon. They have a high risk of colon cancer. Possibilities of treatment, screening, and monitoring. Now, liquid biopsy is a new field which has completely dominated today. In liquid biopsy, we just take blood of the patient, and from blood, we study the genes, and they tell us many information: what type of cancer, what treatment, and after giving treatment, what is the result. See, basic symptoms of cancer. What are the common symptoms of cancer? Brain tumor, say brain tumor or brain cancer or glioblastoma multiforme. You will have headache and vomiting, and this vomiting is known as projectile vomiting. Eye cancer, retinoblastoma, children, usually young children develop. So, so eye cancer, retinoblastoma. In this, you can see cat's eye sign in the babies. If you look at the eye of the baby, you will see one screen is there inside the baby, just like a cat's eye. Oral cavity cancer, that ulcer in the oral cavity. Vocal cord cancer, suddenly dull or harshness of voice. Lung cancer, symptoms are just like tuberculosis. Cough, blood is sputum, evening rise of temperature. Breast cancer, usually lump in the breast. Stomach cancer, no appetite, and patient will have severe pain of the abdomen. Liver cancer, jaundice, pain, vomiting. Kidney and urinary bladder, usually bleeding. It is known as painless hematuria. If there is bleeding without pain, it signifies maybe bladder cancer or kidney cancer. Ovarian cancer, usually they are detected in advanced stage with pain abdomen and swelling and ascites. Uterus and cervix cancer, bleeding, white discharge, back pain, sometimes leg swelling. Testicular tumor, swelling of the testicle, rectum, bleeding and pain. Bone cancer, osteosarcoma, pain and swelling in the bone. So these are the common cancers with common symptoms, but cancer can present with any symptom. How cancer spread in the body? There are four types of spread. One is direct spread, like basal cell carcinoma. They usually happens near the skin, neck, nose, or face, and they go straight. This is known as direct spread. Then through blood, which is the common route. Cancer enters into the bloodstream and it moves whole body through blood. Through lymphatic system, cancer goes through the lymphatic system through the nodes. That's why we always measure the nodes. And through the body cavity, sometimes like breast cancer, it goes to liver. And from liver, it drops inside the body cavity on the ovary, which is known as Krukenberg's tumor. So this type of spread is known as transcelomic spread. So these are the four types of spread for cancer. Staging. There are different methods how we stage. A common one is TNM staging. For uterus and all, we use FIGO staging. For lymphoma, we use Ann Arbor staging. Besides this, there are many other ways how we do the staging of the cancer. Now, treatments usually surgery, radiotherapy, chemotherapy, then biotherapy. We do treatment of the cancer by various chemicals which will block the receptor. This is known as biotherapy. Immunotherapy. Nowadays, immunotherapy is coming in a very big way, whereby we remove the block around the cancer cell. Okay, and then we can easily kill them. Gene therapy. By gene therapy, we can directly block the gene which is causing cancer. Hormone therapy. By hormone therapy, also we can prolong survival in like in breast cancer. Now, what is radiation therapy? Now, radiation therapy are very high energy radiation which will shrink the tumor. The radiation may be delivered by a machine from outside the body, which is known as teletherapy, and from inside the body, which is known as brachytherapy. Now, sometimes we give systemic radiation by various radioactive chemicals like radioactive iodine. We give iodine therapy for thyroid. Okay. Now, benefits of high end. See, many people say that treatment is very costly, but if you give the right treatment at the beginning, then the chance of the disease coming back is much less. So in US, they have done a study, and they found that in 20 years they have done the study. They found that if they could have given the right treatment at the beginning or the first time, there would be a benefit of 278 to 365 billion dollar, which is equivalent to 2,78,000 to 3,65,000 crore of rupees in 20 years if they could have given the right treatment at the beginning. This has come in Lancet. Very important study. Now, types of radiation, there are many types: alpha, beta, gamma, X, neutron beam. So this is the penetration. Alpha is very thin. It can be blocked by a paper. Beta passes through paper but blocked by thin aluminium. Gamma passes water, paper, aluminium, but it can be blocked by lead. And neutron beam can be blocked only by water. You know, that everything it passes through. So how does radiotherapy work? So this is from outside. The patient is lying here. This is the radiation machine which is giving ray. This is known as external beam radiation. And this is from inside, like tumor is in the lung. I am treating from here. This is my source. This is known as brachytherapy from inside the body. Now, what is the principle of radiation? So, in radiation principle, when we this is the ray which is coming, it will fall on an electron. Either it will remove the electron, or this electron will go to a higher level and then it will come down. So, these are the different ways how the radiation works in the cancer cell. See here, radiation comes, the ray falls on the water molecule, which is everywhere. From here, we get a free radical, okay, hydroxyl OH radical, which is free. One electron is less. So it will go near the chromosome of the cancer cell gene, take the electron from here and destroy this gene. This way, the radiation kills the cancer cell. Even in some places, like soil contains radon, and radon emits radiation. So those people who are living in those soil, those places, they get so much of radiation that they suffer from lung cancer and many other cancer. So is a normal cell. Now radiation source has heated this, DNA change happened, then it has become cancerous. And from one cancer cell, very short time, you will get all out of cancer. So this is very important. So first cobalt machine was used in Italy, installed in Borgo Valsugana in 1953. So this is the machine through which ray was coming on the patient. But that time they didn't know this ray can cause cancer to all other people. All of them died later by cancer. So this is very, very important. You must guard yourself during radiotherapy. This is another machine, linear accelerator. These are the usual development. I'm showing you how the development happened. So this linear accelerator, this baby was treated first time in USA, Stanford. Is a eye cancer, retinoblastoma case, and he survived 20 years after treatment. This is more advanced development. This is known as IMRT, intensity modulated radiotherapy. Here, suppose this is cancer is here, so I'm treating only this area with 100% dose. Other areas are getting very little dose. Okay, this is very important to save the normal structures. So this technique is known as IMRT. So this is the treatment of tonsil cancer. So I am treating the tonsil, but I am saving parotid gland, spinal cord, and all important structures. So this is very important for IMRT planning. This is IGRT, image guided radiotherapy. Here we treat as per the image. So this is the first machine in Asia what we got. So this is the plan. So cancer is there in the lung. After 36 days, it has become half. This is due to IGRT, image guided radiotherapy. A normal lung is not getting any radiation. See, this is the normal lung, not getting any radiation, and cancer is getting maximum. Then we have tomotherapy. In 2002, they have started tomotherapy. And in tomotherapy means we cut the tumor by radiation and treat slice by slice. So I'll show you how this tomotherapy works.
I'm Rock Mackey, co-founder of Tomotherapy. I will walk you through the steps.
So you will see this is the machine, and we make the patient lie down on this couch. And first, after making the patient lie down on the couch, we are taking the CT scan every day before treatment. See, we are taking the CT scan of that area. His cancer is in the mouth. So we are taking the CT scan of the head and neck every day. It is done before the starting of the treatment. So once the CT scan is taken, then this CT scan will be shifted to the actual image here. This is the planning of the CT scan. So we will shift this one actual CT scan what we have done to the planning area, which we have already planned. And now we are moving the couch. See this bed, this is known as couch. It is moving up and down, left and right, so that everything matches here 100%, both the images. So once this image fixation is done, means they match completely, then the ray will start. See, this is the ray, this red one, and machine is rotating all around the patient. And I'll show you in the next slide how the ray is coming. See, ray is slowly coming from above below. It is known as helical. This is helical intensity modulation therapy. So it's a very sophisticated. See here you can see the ray has started from the top of the head, then slowly ray is coming down. See the red one. The red one is slowly coming down. See how it has come down. So this is the way how the tomotherapy works. So if you see a patient having, say, head and neck cancer, cancer somewhere in the mouth, see this is the area I am treating, but in different slice, this area is also different depending on the breadth of the cancer, depth of the cancer. So in some slice it is full, some slice it is half. So like that, depending on the slice size, my radiation also changes, and so that I can save the normal thing like parotid gland, I can save the spinal cord, so we can save all the normal structure. See, we are treating different slices as per the disease. Next is the CyberKnife. It is a robot, and we do radio surgery. By ray, I will do surgery. This is very, very interesting. See, this is the machine. So entire radiotherapy machine is this one only. And ray is coming from this area, which is known as gantry. This is the robot, which moves in 6 axes in all around the patient. And these are the two camera I mean, these are the X-ray machine, which when patient is lying on this bed, continuously they are taking X-ray of the patient. I'll show you. And this is a camera known as Synchrony. When the patient is lying here, we put a jacket, and on the jacket, LED light is there. So, along with the respiratory movement, the lights are blinking, and this camera will take the blink and it will show how he is taking respiration. I'll show you. Next is synchronic camera, and the X-ray is taken from these two machines, and this is the X-ray film. What we see here. From here, information goes to the robot, and accordingly, the robot moves. So I'll just show you how this cyberknife works. So you just see how this machine works. This is known as radio surgery. I am treating the tumor with pinpoint accuracy. So when there is rays coming to the tumor, I'll show you the next slides. When I will treat this patient, suppose I am going to treat the lung. So in that situation, when I am going to treat the lung, this or brain, suppose I am going to treat the brain. So how it is accurately treating the brain area, brain tumor. Suppose I have a tumor just behind the eyeball. See, so many tumors we can treat: meningioma, acoustic neuroma, metastasis from cancer, ABM, arteriovenous malformation, astrocytoma, glioblastoma. See how the rays are coming. They are coming from all directions, but pinpointing only on the tumor, and that way they destroy the tumor. I'll show you here how actually it is happening, and this machine we have. So, see, this is the brain tumor. This is the brain tumor. Now, this machine is seeing the tumor from different angle, and X-ray has happened. This X-ray is showing exactly where is the tumor. So it is treated by that light. See, again X-ray happened. Again, it is treating the tumor with pinpoint accuracy. So here the most important thing is accuracy is very high. We treat only the tumor, and normal brain get very little dose. As a result, side effects are extremely low. But as we can give very high dose, see X-rays are taken, and after X-ray, how the rays are going to the tumor with pinpoint accuracy. See, it is falling only on the tumor. It is not touching any part of the brain. So the side effects are extremely low, and results are very good because we give very high dose, so we can completely destroy the cancer part. So no little or no side effect of the cancer. Same thing we can do with the lung. See, I'll tell you, in the lung, when I'm treating, lung is breathing is happening. So tumor is moving. Okay, so tumor is moving. So during the time, see in the lung how it is treating.
Treating lung tumors with radiation is challenging. Tumors in the chest can move as much as 2.
So see, this is the tumor in the lung. Now the most dangerous thing is lung breathing is happening, and this is the I told you the jacket LED light is blinking and camera is catching. Now see how the machine is giving the radiation. It is going near the tumor and giving with pinpoint accuracy, and see that light is moving along with the breathing. See inside what is happening. Though it is moving, but it is treating perfectly. An entire treatment can be completed within 1 week. See, this is the tumor which is moving along with the breathing, and rays falling continuously only on the tumor. And this result is extremely good. We can give very high dose of radiation. Only in 5 days, entire treatment will be completed. Normally, it takes 6 to 7 weeks if we treat with other machine. But here, only in 5 days or even 3 days, I can completely treat the entire cancer. So these are the beauty of this treatment. Now, this is a very, very sophisticated machine. Very recently, we got. In India only we have, this is known as ethos. Now the beauty of ethos is no other machine has artificial intelligence, but this machine has artificial intelligence. So the machine itself can plan every day, and only the doctor must be there. Radiation oncology should be there to put the setup to see that everything is perfect. Otherwise, machine treats every day. So we can save the normal structure. We can give 100% dose to the tumor area. See, this is the machine. So this is the treatment couch on which patient lies, and from this machine the ray is coming to the patient, and this is artificial intelligence. So every day the machine sees where is the tumor, what changes happened in the tumor, and according to that change the field of the treatment is reducing. As a result, the side effects are much less, and results is, see here I'll show you one of the plan, like how this machine is working. So the patient, see, this is the patient. This is the patient. He is lying. The machine is taking his contour. It is completely delineating the patient, and it is taking the scan of the patient. Every day it takes the scan automatically. And this is a very sophisticated scan, okay, known as kilovoltage. And this is the tumor area. And every day we see the changes in the tumor area. See how in the scan we are seeing every day we see the changes, what is happening. If the tumor is shrinking, the field will also shrink. My treatment area also will shrink. So that's why this is a very, very sophisticated treatment. See how the planning is happening, and then how it is treating the patient. Okay, this is ethos. So actually, this is the treatment area. This one of the head and neck. This is the head, and every day I'm treating this area, but every day it is shrinking as per that day's position of the tumor. So it is a very accurate therapy. It's one of the best therapy of the world. And nobody bothered is also effective. Okay, so this is ethos. Now this is, I want to show CyberKnife treatment. So this is the patient. These are the two kidneys, and there were small tumors. These are the cancers, small tumors on the back. This is the spine, spinal cord, and these are the tumors. And it was very difficult to treat them without treating the spinal cord, and spinal cord will be destroyed if we give very high dose. But see, in CyberKnife, when I have planned only, there are 4 or 5 lesions, small tumors. Here, 1, 2, 3, 4, 5. So I have targeted only the tumors, and kidneys are saved completely. Okay, only the tumors I have targeted. And see, when I have planning is like this. These are the rays which are coming from CyberKnife machine, and they are treating only these 2 small tumors, nowhere else, and 100% treatment. This graph is showing 100% treatment to these 2 tumors, and patient got completely relieved. Now this is another interesting thing of CyberKnife. See, this is the spine, vertebra, and cancer has eaten up almost entire, and spinal cord is pressed to one corner, this one. Now, if you give any other radiation, definitely you will damage the spinal cord, because ray will fall in the whole area. So spinal cord also will get ray and it will be damaged. But in CyberKnife, I can treat only this much, and I can completely save the spinal cord. So that is the beauty of CyberKnife. Now this is another beam, proton beam. This is a huge setup, almost 200 to 300 crores is required, and proton is produced in synchrocyclotron 1.5 kilometer away from your hospital. Then it will travel and comes with the speed of light and enters the hospital and treats the patient. So this is the proton beam. The beauty is, in any other radiation, if you give ray to this tumor in the brain, some ray will be there in the track up to the end. But in the proton beam, the moment you have treated the tumor, immediately it stops. There is no other ray behind. So this is a huge advantage. See, this is the brain tumor, and this will be treated by proton with pinpoint accuracy. Now, what is chemotherapy? So chemotherapy is the treatment of the cancer by drugs or chemicals. Now, first chemotherapy was discovered after Second World War from nitrogen mustard gas, which was used in gas chamber to kill the patient. Later, they found this nitrogen mustard can destroy the DNA, and first drug of the chemotherapy came was nitrogen mustard. Today also we are using this nitrogen mustard in lymphoma, the cancer of the lymph gland. Second chemotherapy drug came in 1947, methotrexate, discovered in Dana-Farber Cancer Institute in Boston. Third drug came as 5-FU. Like that, hundreds of chemotherapy drugs came today. A very important cancer drug is paclitaxel, which is used in breast cancer, ovary cancer, and many other cancers, discovered in 1979. Today, it is used in almost all cancers. Immunotherapy is cancer cells completely cover them with some chemicals so that body's immune system cannot kill them. But immunotherapy will go and remove those masks around the cancer cell, and cancer cell will be exposed and it will be killed by the body's mechanism, defense system. And a new therapy has come, which is known as CAR T cell therapy, which is also coming in a very big way today in immunotherapy. This is the surgery today, Da Vinci robot. So very interesting is it is just like a robot game. Surgery is not at all near the surgery site. He is away, and he has put some arms inside this abdomen. And I'm showing it very big way. Actually, they're very small, and they have those arms have scissors. So from outside, surgeon is controlling the machine and cutting this. I'll show you. See, surgeon is sitting here. He is seeing in this console, and he is playing with his hand here. He is moving the hand, and here the treatment. So the patient is here, and all these are here. And inside, the machine is cutting the tumor. It will cut the tumor. It will stitch the area. It will crush the tumor and take out through small hole, only 3 to 4 holes, and entire surgery is done. So this is one of the very advanced surgery which is happening today, which is known as Da Vinci, by Da Vinci robot. So almost all surgeries today we are doing by Da Vinci. So advantage is next day you can be discharged. Okay, and results are also very good. Now, there is a therapy recently, it has come known as alpha therapy in cancer. In very advanced prostate cancer, we do alpha therapy. Alpha are very small particle, maximum 1 to 2 cell they go. This is beta radiation. This is alpha. So it has tremendous effect in cancer. See, in a prostate cancer which spreads everywhere, except these two black, these are kidney, other all are cancer only in the whole body. See, all bone from head up to foot. Now see, after alpha therapy, everything is gone. These are the normal kidney. So just see the result. When nothing works here, everything fails. Only alpha therapy can save a patient, and completely it can remove the cancer. Now today we are going to theranostics by all these isotopes we are treating. This is a very important FAPI theranostic, FAPI therapy. FAPI is the chemical. So why FAPI is so important? Because cancer cells produce as fibroblast, and this fibroblast is targeted in the scan, which is known as OncoView, and this fibroblast is targeted by radioisotope, which kills the cancer. Okay, which kills the cancer. See, this cancer is detected by OncoView, the scan, FAPI scan. It is in the colon. It is in the stomach. So this is light is coming from OncoView scan, which is showing exactly where is the cancer in the stomach. This is the stomach. This one is the stomach. Now, interesting thing is when there is a cancer, it is only in 2-3 small places. But when we treat, we have to treat a bigger area. because fibroblasts are there, which are cancer fibroblasts. So if you treat this one, cancer will remain. So you have to treat a bigger area. So FAPI is showing, FAPI scan, how you to treat. See, it is much bigger than this. This is much bigger than this. So you have to treat a bigger area. So by FAPI, you can accurately treat a cancer. Results are much better. There are different FAPI, FAPI 4, FAPI 9. Now FAPI 18 is coming. So they will increase our accuracy much more. These are the side effects. See here. This is a cancer who came before with so much of cancer. All these lights are cancer only in the abdomen. Okay? Is ovary, cancer of the ovary. Okay. Now, after treatment, it has reduced. It has reduced. And further, it will reduce as the time will go. It is only after 3 months. See, this is a patient came with a huge cancer in the adrenal gland. Huge cancer. See, after FAPI therapy, no cancer. So FAPI sometimes shows extremely good results, and these are given in the last stage when no other treatment works. So FAPI therapy plays tremendous role today in cancer treatment. Thank you. So if you have any question, you can ask me.
Thank you so much, sir. Thank you for such an overwhelming talk that you have shared on our platform with such wonderful presentation and slides by the way you have explained it to our viewers. We have received few questions from our participants, sir. With all your due permission, I would like to put across those questions to you.
Yeah.
So the first question is related to the genomic profiling. So if we can discuss a case where genomic profiling significantly altered the treatment plan for a cancer patient.
Yes. So the most important thing is all these cancers are due to gene. And it is not one gene. There are millions of genes in the body which control the cancer growth, cancer management, resistance to the treatment. Everything is controlled by the gene. So today in HCG, what we do, the moment a patient comes, first we do the gene diagnosis. We study 500 genes. This is known as TSO 500. So we take a sample by biopsy, and on that we did the gene test. And we know which are the gene responsible for the cancer, and then we can treat accordingly. Gene will only tell what treatment to be given. So gene
Thank you so
therapy
much.
today is very important.
Thank you so much, sir. Thank you for answering that question. Moving ahead with another question that we have received, and the question is related to the considerations. So, what considerations should be made when combining immunotherapy with other modalities like chemotherapy or radiation?
Yeah, sorry, just give me 1 minute. The battery is getting low. I'll just connect.
Sure, sure, sir. Sure.
Yeah. So, can you repeat your question? Hello?
Sure, sir. So, the question is, what considerations should be made when combining immunotherapy with other modalities like chemotherapy or radiation?
Okay. So I told you that a cancer cell actually is foreign to the body. So in our body, or in our immune system, big cells are there like macrophages. If they know that this is a foreigner, they can kill. Even they can kill cancer patient. That much power we have. But cancer cells are very smart. They cover them with a chemical. And I have done some research and I found it is nitrous oxide. So nitrous oxide, the cancer cells cover them completely, and they mask the immune system. So our immune system think they are our own, so they don't destroy them. But actually, they are not our own; they are foreign body. But because the cancer cell befool the immune system, so immune system cannot kill them. But immunotherapy are chemical which will go inside and they will remove that protective covering of the cancer cell. So now cancer cells will be exposed and our immune system, the macrophages, can kill them. So this is immune therapy. So we have found if you add immunotherapy with a chemotherapy or a biotherapy, then the results are much better. So immunotherapy will expose the cancer cell and chemotherapy will kill the cancer cell. That's why we
Thank you.
combine immunotherapy with chemotherapy.
Thank you so much, sir. Thank you for answering that question. Moving ahead with another question that we have received, and the question is related to the minimally invasive approach. So, if you can share an example where a minimally invasive approach resulted in better patient recovery and prognosis.
So see, today the most important thing in cancer, there is a huge change in cancer management or treatment today. Today, first we see the cause of cancer, that is the genes which are causing the cancer. So we have our genomic study platform. We have that lab, gene lab. There we study 500 genes, which is known as TSO 500. This is the first requirement. Then we do the PET scan and we see, and we have 13 different types of PET scans. So any cancer we can detect with pinpoint accuracy. So we detect the cancer in the whole body. And then from gene, we know which genes are causing the cancer. And gene itself tells us what should be the treatment. Like PDL1, if a cancer is PDL1 positive or cancer has tumor mutation burden high, they are highly susceptible to immunotherapy. Or there are so many injections and medicines have come which are targeted against particular gene. These are genetic therapy. Or there are so many new drugs have come which are known as biotherapy, which will block the receptor in the body. So there are various ways today how we treat a cancer. So the fastest way is to do the PET scan, do the gene test, and then you proceed accordingly with pinpoint accuracy. That is very, very important because in cancer, first treatment is the best treatment. If in the first treatment you do something not clear cut, you do here and there, then it is gone. Cancer cells will be resistant, so nothing can improve it. That's why first treatment should be the best treatment and most accurate scientific treatment.
Thank you so much, sir. Thank you for answering that question. Moving ahead with another question, and the last question before we conclude the session here for today. The question is related to the targeted therapies. So, how have targeted therapies revolutionized the management of specific cancer types, such as non small cell lung cancer?
Yeah. So suppose somebody is diagnosed with non-small cell lung cancer. Now, non-small cell lung cancer has subtypes like squamous cell carcinoma, adenocarcinoma, large cell carcinoma, then oat cell carcinoma. Okay, so there are different types in the lung cancer in the non-small cell category. So suppose you have a small non-small cell like adenocarcinoma. Now, what we do? We do some genes which are a must, like EGFR, epithelial growth factor receptor, then ALK. Okay, so EGFR, ALK, then we go for say some other genes, but these are very, very important: EGFR, ALK, ROS, PDL1, MSH. So suppose EGFR is mutated. Now, if EGFR is mutated, this means it will be resistant to your chemotherapy and other thing. So you have to give a particular drug which is known as osimertinib, and it will respond very well. Like recently, we have seen some of the patients, they were not responding to any therapy. So when we did their gene study, EGFR, we found their EGFR mutated. So if EGFR mutation is there, then you should know what exact drug will work, and you have to give that drug. Same, if it is ALK mutated, then you should give a drug known as crizotinib. So if you give crizotinib, the result will be extremely good, but other drugs will not work. So this shows that even for breast cancer today, now there are so many genes which are very important, like PIK3CA. If PIK3CA gene is positive, you have to give specific drug for that. alpelisiliv, and many other TKI, tyrosine kinase inhibitors. So today treatment is completely tumor specific, gene specific. You cannot give left and right chemotherapy or other drugs. You have to know exactly which drug to be given. And this knowledge you will get from the gene study, and which is a must today for cancer management.
Thank you so much, sir. Thank you for answering that question and all the other questions that our viewers have asked and for resolving their queries. I would also like to thank all our viewers for their ardent participation that they have shown by staying tuned with us throughout the session and putting across these questions to us. And at the outset, I would also like to thank you, sir, for taking out your valuable time and for being here at our platform and sharing such wonderful insights and for letting us know about the diagnosis and management and the shift that has caused cancer to overcome this dreadful disease that people had in their mind. So thank you so much, sir. Thank you for being at our platform and giving us this honor. So before we end the talk here, sir, any last take-home message from your end?
So my suggestion is today, what I see in my hospital, that many patients come from all over the world to us, and also from our Karnataka and from India and different parts. One of the most important thing is don't jump on treatment. Please see everything and do scientific analysis and find the cause. Cancer is not going to spread immediately. You wait for another 7 to 10 days, no problem. But don't start immediately any treatment. You do PET scan, see whole body. You do genomics, see exact which genes are responsible, what should be the treatment. Then only you plan the treatment. You can start, sometimes genomic takes 4 weeks. You can start some treatment, but once the report comes, immediately modify your treatment and give the right treatment. This will save the patient and it will avoid the recurrence. Otherwise, cancer will come back very shortly. So my answer, request to everyone: don't jump on cancer therapy. Do all the tests, PET scan, genomic, and all other things. Confirm 100% and do the scientific treatment.
Thank you so much, sir. Thank you for your last take home message. And with this, we would like to conclude the session here for today. Until next time, I would request our viewers to stay tuned for further sessions that will be taking place at our platform. Thank you so much, everyone.
Thank you. Thank you.